is quite serious. However, we are seeing lower numbers of hospitalizations and lower numbers of new cases now. So the efforts of staying at home is actually working. So there are a few topics that we'd like to talk about today, and the presentation will be split into two. I'll be talking about the first three, and Dr. Pong will be talking about the last three. So we're going to present on common concerns seen in teens at homeschool during COVID-19 crisis, how to support our teens at home, how to care for yourself as a means of helping others. And Dr. Pong will be presenting on teens with difficulties prior to COVID-19, warning signs for teens who may need additional help, and means and sources for professional help. Okay, so some of the common challenges that we see in our teenagers are frustration and boredom from sheltering at home or being homeschooled. That means they have no in-person contact with their peers. They're also experiencing some cabin fever. Canceled rites of passages and milestones. For instance, prom was canceled, graduation was canceled. They'll never get that back. So these are some issues that we have to work through. Unknown academic futures. Right now, a lot of colleges are closed. They're doing education through virtual means, and we're not too sure what's going to happen in the fall. Unstable family financial situations. A lot of people are now unemployed or furloughed. They don't know when they can start earning again, or when, or if their job will even exist afterwards. So it causes a lot of stress for the family. Difficulties with virtual education. This is the first time everyone is now doing virtual education. There are a lot of adjustments, a huge learning curve that we have to get through. So there are some difficulties with that. And of course, there's some difficulties with loss of family or friends due to COVID-19. And unfortunately, there's a lot of difficulty with fear and anxiety over the spread of COVID-19. So with that in mind, there are some changes that we see in teenagers. And there are a lot of emotions that our adolescents may experience. They might experience some increased irritability, emotional reactivity, frustration, anxiety, and anger, sadness and grief. And all these emotions can be seen through the changes in their behaviors. For example, you'll see changes in their routines, their sleeping habits. They might be sleeping throughout the day or having really hard time sleeping at night. They might not like doing the things that they used to love doing, or they might just start withdrawing from communicating with friends. You'll also see some dysregulated behaviors, and that includes not attending classes or not having assignments turned in on time, having temper tantrums, or even running away from home. Now, these are very risky behaviors, and these are also expected reactions because of the reality that we're in today. Now, there is a biological reason for this. Now, our brain develops in different ways. First, our emotions develop in the limbic system over here, and that emotional part of the brain develops a lot faster than the judgment area of the brain. The judgment area is called the prefrontal cortex, and that involves judgment, decision-making, and impulse control. And that lags behind the emotional part of the brain. So the prefrontal cortex, which again includes the judgment, decision-making, and impulse control, doesn't fully mature until we're well into our 20s. So we have a young brain that's just filled with emotions, and it doesn't have those controls to stop them from acting on those emotions. And of course, this is totally normal because that's just how the brain develops. Now, because of the development of the brain, teenagers who experience stress are more likely to have their stressors turn into anxiety. Now, anxiety really comes from a place of fear, worry, and unease out of proportion to the actual stress, to the point where you start to feel anxious about being anxious. Now, persistent stress and anxiety can affect the brain structure and function, and therefore affect the ability to make decisions and learn from those decisions. So it is really detrimental to the development of our children. And anxiety does present in a lot of ways. One of the ways that we're seeing is emotional and behavioral dysregulation. And that's an inability to manage uncomfortable emotions. Oppositional behaviors like acting out or yelling, mood swings, anger outbursts. And these are all seen during times of distress in less validating environments. And of course, in our COVID-19 crisis, we are inherently in a less validating environment, but there are also less validating environments at our home. For instance, if adults are passive aggressive to their kids or constantly yelling at them or being upset at them, that becomes a less validating environment, and it's really detrimental to the development of our kids as well. So that was a lot of information, and I just wanted to sum everything up. More stress, especially in the COVID crisis, will lead to more emotional dysregulation, will then lead to more risky behaviors. So the real question is, how can we help? How can we help our kids, right? And the first thing that we can do is to talk to them. We have to talk to our kids, and we have to do so by listening and learning from them. A lot of times they don't want to open up to us because they fear this rejection or overreaction that we might have. And we need to let them feel accepted. And in order to do so, that relationship needs to be built on trust and respect in order to foster this relationship of acceptance. Now, one conversation that we need to have with our teens, especially during this time, is about COVID-19. We need to understand how COVID-19 affects our teenagers. And in order to do so, we need to use trusted resources, such as the Center for Disease Control and Prevention, or the CDC, in order to get our information. We need to try not to rely solely on social media resources for information. There's a lot of misinformation out there that could ultimately lead to more harm than good. And we want to try to use trusted resources in order to get our information. Now, we also want to discuss ways we can protect ourselves and our children from getting infected. For instance, if they're going out to public areas, you could tell them that you have to wash your hands for 20 seconds, especially when you're touching elevators or sitting at the park bench. Just make sure to wash your hands so that you don't get infected. You could also discuss ways on how to protect others at risk. For example, if they want to go out and play with their friends and they're asking, why not? You could say, hey, I know you really want to go out right now, but right now is not the time. Because if you play with your friends right now, or like have basketball games, you might infect them, and they might have people living at home who are elderly or immunocompromised, and they may get even more sick from getting infected. So having these discussions with our kids is very important. So now that we're all sheltered at home, how do we keep that sense of stability in mind? In order to keep that sense of stability, we need to create a routine, maintain rules, and set limits. It, again, creates this sense of stability, security, and structure that's very important in the home. You have to work with your teenagers. It's really a shared decision-making process, and it's shared responsibilities as well. And there's a YouTube link that I have here that you can watch later on. And I believe the PDFs will be sent out so that you could have this later on. But I do want to go through some tips on how to create a routine and a supportive environment. And the first thing, again, is to create that schedule. You really, really have to write it down. Establish times for waking up, when to have meals, activities, when to go to bed. Get dressed for the day you want to have. Try not to stay in pajamas, because a lot of times we're more productive when we're ready to work. Have a dedicated work and study space. Try to keep the work schedule and the space that you use for working. And of course, you have to schedule break times. Everyone needs a break around this time. Be adaptable, but also be firm. This is the first time that we're all stuck in this, and you have to play everything by ear. It's a lot of trial and error, and do what works for you and your family. So I wanted to talk to you about the importance of sleep, because having a routine on when you wake up and when you sleep is probably one of the most important aspects about creating the schedule. About 8 to 10 hours of sleep for adolescents is recommended by pediatricians, and you have a lot of fewer attention and behavior issues with good sleep. So not everyone can have good sleep throughout the night. And I know I have issues with sleeping sometimes, and there are some ways that you could help yourself have good restful sleep. So the first thing is to have a cool and dark environment in your house, in your bedroom, because it prepares the body to sleep. It activates the parasympathetic nervous system so that our body knows that it's time for rest and relaxation. Avoid caffeinated drinks, especially at night. You don't want to have that coffee or that soda at night, because it will definitely keep you up. You want to avoid screens in the bedroom. That light from your phone or your iPad or your tablet will activate your brain and tell your brain that, hey, it's time to wake up when it's really time to sleep. So you want to avoid those screens in the bedroom. Try to be active throughout the day. Go out for a walk, take a jog. Yeah, of course, keep that social distancing of 6 foot across from people and not in your household, but be active throughout the day so that you're tired later on at night and then you could sleep. Also practice mindfulness. A lot of times when we're practicing mindfulness and being in the moment, we're able to relax and rest properly. And be a positive example for your children. A lot of times they see what we're doing and they know that they have to also follow as well. So being that positive example for your children will go a long way in this. So I have a link down here, another YouTube video that shows you how to sleep in 2 minutes if you're interested in watching later on. Okay, so oftentimes kids can tell when we're stressed, anxious, or sad, and they pick up these emotions from us and they respond accordingly. So it really is in our best interest and their best interest to take care of ourselves mentally and physically. Of course, you have to keep your routines as best you can and model for them to keep the routines as well. Sleeping and exercising is also very important. Having social support, calling your friends, your family, your loved ones, your parents, having that support will go a long way in helping our mental and physical wellness. Nutrition and hydration is also important. Avoiding drugs and alcohol. We're seeing a lot of people use more drugs and alcohol, especially during stressful times, because they're self-medicating. And it's not a very good idea to do this because it goes in the wrong direction. And having that positive thinking is very important as well during this time. So now we know a little bit about the importance of routine, a schedule, and how to better take care of ourselves. How do we fill that schedule up? And you really use this time as an opportunity to invest more in family time. And it involves being creative and adaptable. You have to try to create something together. You could do paint night, you could draw, just have that family moment together. You could do chores together. I know a lot of kids don't want to do chores, but if you do it with them, they might, feel more inclined to help out more. Be that model for them as well. You could also connect with friends and family members with technology. I don't really like the term social distancing because it's not really social distancing. It's more about physical distancing. You're distancing apart from each other, but you're keeping in contact. And we want to do everything together and playing games together with your kids as well. Try to understand what they like to do. Which games do they like to play? Play cards, play board games, or even the Nintendo Switch, whatever they want to do, try to learn what they're interested in as well. And it really puts a lot into investing in family time. So now because we're all stuck at home and our kids, with our kids for many hours of the day, we have another unique opportunity to observe how our children learns. And it's to be involved in the e-classroom. The e-classroom does pose unique challenges to teenagers and students. There are unique responses towards online learning. A lot of people thrive in this environment, but also some don't respond well to online learning. So it's difficult for teachers to observe this, especially in the e-classroom when they don't have that face-to-face with your child. So it's a good opportunity to observe how your child learns. Are your kids engaged? When do they stop paying attention? These are things that you could talk to their teachers and try to facilitate that communication between your kids and the teachers to reach the educational goals. Now, since everything is virtual, there are a lot of milestones that our kids miss out on. Just to name a few: graduation, prom, sports competitions, birthdays, and many more. I challenge you to think about the time when you were getting ready for your prom or your graduation or that football game that you were practicing many hours for, and now think about if it were canceled. It's a very disappointing situation, and with that in mind, you have to have innovative solutions at play. And again, it's about being creative and open-minded. You could design social activities and celebrations with friends and family members or school communities. Even with all this, it won't be the same. So we're gonna have to help our kids through this disappointment. And dealing with disappointment is a very complicated issue. And there are 5 steps to help our children cope with this type of disappointment. First is to acknowledge their feelings. Give them that space. It's really okay to feel what they're feeling. Try to just sit with those emotions and not try to fix it. Just sit with it and say, it's okay. Have that space with them. Help them get some perspective. A lot of times when we understand the perspective of other people and how this has impacted them, we could understand how it impacts us as well, and we could better cope with the situation that we're facing today. We could also help them know and keep their values, their positive values. Reflecting on positive values, that make them who they are. For instance, are your children outgoing and social? So you should encourage them to keep in contact with their friends and family members, to keep that aspect, to keep those positive aspects of themselves up. Help them to practice acceptance. Acceptance is one of the hardest things to do. And we say practice acceptance because it does take a lot of work. If we can practice accepting the situation we're in right now, we could better prepare for what's happening right now and prepare for the future later on. So having that acceptance will go a long way in also helping them develop coping skills later on. And lastly, we have to believe in hope. It's really easy to fall into hopelessness around this time, but help them believe that hope is just is there, and good times are right over the horizon. And believing in hope is one of the best things that we could do for our kids as well. So unfortunately, for this COVID-19 crisis, sometimes we will have to go through grief, and some people are experiencing grief. And there are different types of grief reactions. Grief occurs when someone has suffered a loss. It could be a loved one or something. And it may lead to feelings of sadness, anger, guilt, or regret. There are also traumatic grief reactions when someone has suffered a traumatic loss. And survivors of this, they sometimes focus on the circumstances that surround the death. For example, being preoccupied with how the death could have been prevented, or what the last moments were like, or who's at fault for causing this. These reactions might interfere with the person going through and getting through this period of grief. There are adaptive coping mechanisms. For example, seeking support from others, calling friends or family and loved ones, talking about the ones that they missed, taking breaks, rest, nutrition, having adequate exercise. These are all good ways to cope with grief. There are also maladaptive ways to cope with grief, withdrawing from activities, friends or family members, or even starting to use alcohol or drugs at an excessive rate. So those are not really good ways to cope with grief. How we can help our children grieve is very similar to how to help them deal with disappointment. It's about giving that space, listening to what they have to say. You have to provide reassurance and validate their emotions. And you also have to reestablish family routines. And I really want to emphasize the family routines, because it does have like a sense of normalcy create that sense of stability back into the family home. And we want to try to give that sense of security back to them. So that is the end of my portion of the presentation. However, I do want to go through a YouTube video. It was a lot of information, so I want to sort of take a breather. This is a breathing exercise that we teach a lot of people on, just how to relax a little bit. So I'm going to share this screen. 1 second here. And just try to follow along with it, and just take a moment to just breathe.
So there are a variety of breathing exercises that you can do that will quickly ground yourself in the midst of stress as well as anxiety. So what you can do is find a chair that you feel comfortable in, have your feet flat on the floor, your hands resting comfortably on your lap, and just take 2 deep breaths, one in through your nose, and out through your mouth. Good. One more in through your nose, and out through your mouth. Just gently smooth your lips and allow your breath to return to its natural rhythm. No more deep and no more shallow. Just notice the air going in and the air going out. Noticing the cool air in and the cool air out. You can do this for a few moments. Noticing your chest rising and falling as the cool air is flowing up your lungs and your chest falling as the air is leaving. And those just few seconds can help you with that grounding that you might need just to deal with that stress and or anxiety that you might be experiencing.
Okay. All right, so this next part will be presented by Dr. Pong, and she will be talking about teens who have pre-existing emotional and behavioral difficulties prior to COVID-19.
Hi, everyone. Good afternoon. So I'm Dr. Pong. So I work at Staten Island University Hospital as a child adolescent psychiatrist. So the next part, I'm going to talk about kids with pre-existing difficulties. Next slide, please. So at the very beginning, I want to discuss about kids with, commonly seen mental health issues, especially these conditions that have high incidence during this developmental stage. So the first one I want to discuss is about anxiety. So as Dr. Lee mentioned earlier, kids with anxiety, they tend to having this excessive worry about the past and the future, and they have hard time focus on the present. Kids with anxiety can present in many ways, both physically, behaviorally. So kids can have significant difficulty concentrating on the problems at hand, or they have, they presented more fidgeting, difficult communicating their thoughts, and then also they have poor sleep, and then they have difficulty maintaining their daily activities. So these kids, especially, there's another common, I think, familiar condition we call obsessive compulsive disorder, which is also fall into this anxiety spectrum. Then these kids, when they face challenges or they feel more stressed out, they will practice more compulsive behavior, such as washing hands or checking, repeatedly checking. So then they also, some kids can also present symptoms we call panic attacks. So the kids will say that they feel heart palpitation, they have difficulty breathing, tremors, sweating in the hand. So these are the symptoms that we definitely as care providers want to help them immediately, with either direction of how to reduce social media exposure if they worried about contracted with COVID. We also, as we mentioned earlier, practice with the kids together about all these relaxation techniques and helping them to calm down, and then listening to them to see what are the issues at hand. Next slide, please. Kids with ADHD, same thing. This is very challenging time that they will experience increased restlessness during this quarantine time. And then they also have very difficult time adapt to e-learning environment because of the lack of structure or direct guidance or monitoring that they enjoyed in the school environment. And parents working with kids who has ADHD may experience increased stress, especially they have to work with the kids 24/7. So they have to face increased, especially for kids, increased irritability, oppositional behavioral issues, poor impulse control, difficult making the right decision, etc. And parents can really feel burned out at this time. Next slide, please. And then there are also next two issues that basically related to the internet access. So one condition we call internet addiction disorder, which the reason we call addiction disorder because they involve the same brain area that we see in people who have substance abuse issues. So a lot of kids spend a lot of time, at this time, because of they have limited activities or, space, so that they spend even more time on the internet. So among these kids, research showing that about 9 or 10% of these kids meet the criteria of this diagnosis, because these kids, they're showing that significant impairment in their daily functioning. And then they forego their responsibility at this stage. For example, they don't attend school. They don't take care of their own, the routines. A lot of kids sleep, they have very disrupted routine, or they have difficulty engaging with family. Next slide, please. Another issue that related to the internet and social media access is that kids at this stage that they don't have other or limited social interactions outside the house, so they spend more time on the internet. Because they are immature in terms of making right decisions or control their impulsivity, and they can spreading embarrassing photos, videos, or rumors about themselves or peers. And then that's give the opportunity for bullies, basically, humiliate, threaten, or harass them. So they can be the targets. And then which can lead to, if without support, then they can, worsen their depressed symptoms or worsening their anxiety. Sometimes the kids feel like there's no support and there's no way out. And then they can also express elevated, suicidal ideation or even resort to risky behavior. Next slide, please. So depression, again, is very commonly seen in kids at this stage, at this developmental stage. So about 1 out of 10 or 1 out of 8 kids suffering this condition. So during this physical distancing time, so the kids with depression feel even more lonely. They may not have, opportunity to share with a few friends they have, at school. And then also they feel it's difficult to get in touch with their therapist because again of, a lot of outpatient clinics shut down. So that's basically increased the sense of loneliness, increased the sense of hopeless and helpless. And a lot of time, again, the kids will feel more depressed, and then they feel being burdened to their family members, and they can resort again to maladaptive behaviors, including risky behaviors and suicidal behaviors. Next slide, please. So when kids having all these distress or conditions that, okay, and these conditions I mentioned above, they can also coexisting in kids, where kids have multiple issues at the same time. So when kids cannot express themselves, their emotions, or cannot having the support to help them solve their tasks or difficulties, then they resort to maladaptive kind of means, including increased use of substance, alcohol, tobacco, or marijuana. Or they also resort to risky behaviors to try to release their pain or escape from the reality. So as a care provider, we need to keep a closer watch on where they're going and what they're planning to do. When kids complaining about their wear on their back all the time, we need to assure them that this extra checking in is temporary and just until things have stabilized. And then there are times that we do need to contact our healthcare provider to get further support. Next slide, please. So understanding each other in families is very important at this time. Teens with pre-existing emotion or difficulty, emotion or behavioral difficulties usually have low frustration tolerance. So if the environment is less validating, that can further trigger emotional derailment in these kids. Next slide, please. So here we're talking about this dynamic, coercive cycles in the families, that when a kid feels like they're being stressed, frightened, or feeling they're being undermined, distressful, then they can present it in, significant strong emotion, express significant strong emotion that can elicit very powerful emotion in parents or caregivers, who can in the meantime, reactive to kids' behavior and emotion, and then have difficult time understand or even pay attention to the kids' feelings or behaviors, and then also have difficult time working with other members in the family. And then they try to regain the control by forcing the kids to make changes as they expected. And then when these are not achieved, these goals are not achieved, and then the parents also feel, undermined, frustrated, and distressful. And then that can, in turn, causing exacerbating actually the emotional distress in the kids. And this coercive cycles will go on and on. So we want to break this cycle or to avoid this happening by, understanding, the dynamics. Next slide, please. So the difficulties that interfere with our communication in the family, including, basically I'm going to discuss these issues. First of all, is about interpersonal stress. So when parents, we have difficulty communicating with each other. If we're going through, some parents going through a divorce process, or some parents worrying about the kids, they have other kids who have self-injury and drug use problems, or they worry about family members who got sick, or even they have to face, someone, some loved ones recently dead. So these are interpersonal stress that will basically interfere our ability to really think about the thoughts and feelings of our kids. Caregivers can also occupied with other important concrete issues in our life. For example, they may worry about their employment, the stability of their employment, or they worry about finance. They sometimes seeing that the kids are not as engaging as when they're in school in terms of online learning. So they want to focus on the grades or academic achievements, or parents have to manage several kids at home, 24/7, or parents themselves are at the stage of going back to school. So these are extra or multiple tasks that parents are facing are really can interfere with the ability to deal with kids who has significant emotional distress. And then there are also family members or parents, care providers. They are probably will be the victim of the abuse. They're in an abuse relationship, being physically, emotionally, or sexually abused. And then some family members also have, alcohol use difficulty problems as well. Next slide, please. And then some parents or caregivers also suffering long-standing or chronic mental health issues, including depression, anxiety, post-traumatic distress disorder. Depending on the attachment history, sometimes the family members also, it's hard for them to set boundaries. So that parents or kids can play roles of overprotecting or over-dependent on each other. So that will also interfere in helping kids to manage their emotions and behaviors. Single parent family also have this, sometimes during this time also facing significant difficulty in terms of visitation or how to work with one parent versus the other. Sometimes one parent may see that when the kids having coming back from the visits or having difficulty with one of the parents, then the other parents try to overprotect and then assume that the contact with the other or interaction with the other parent is not positive, and then they can cut off the contact with the other parents. I think in these situations, we have to bear in mind that the communication is the key, and then we do want to work together, to cooperate in problem solving. Next slide, please. So understanding each other is very important, and then supportive family interactions provide a context for communication and understanding of children's emotion and needs, so that we can help teens to regain control of their emotion and behaviors. And then how to do that, next slide, please. So we want to watch especially the changes that we've seen in kids who, they may deviate from the kids' normal behavior and functioning level. We want to listen carefully about teens' expressions. And then we also want to watch any stressful presentation or stimuli in their environment. We want to learn and model stress management skills, and want to monitor if the stress affecting our kids, their behavior, emotion, and their functioning level. We want to support kids to involve in positive activities that we mentioned all about, in Dr. Lin's presentation. Parents also need to can help the teens to understand that no one is perfect, that we need to take one step at a time to solve the problems. We need to take, at times, take breaks from stressful situations, and then build a network of friends who can help them to cope up in positive way. We can ask for healthcare providers if we have already, have them in our network, or we link with the kids with healthcare professionals to help develop more effective communication skills and decrease negative self-talk, and then also develop alternative thinking and then solutions to manage the difficulties. And then the healthcare providers can also help us learn and practice coping skills, including relaxation techniques and also developing task management skills. Next, please. So here, I just want to quickly emphasize about the warning signs of suicide. So when kids perceive that they don't have help in their environment, then they will express more negative views about themselves or their surroundings. And then they also express sense of hopelessness and no interest in future planning. They feel very isolated, or they display withdrawn behaviors. They can feel or expressing they're being burdened to others, and then they present increased irritability or drastic changes in their mood and behavior. They can be more aggressive verbally or behaviorally in terms of using more substance or conducting more self-harming behaviors, including cutting behaviors that we commonly see. Next slide, please. So research showing that in the home, if we remove all these risky means, including controlled prescription medications, especially painkillers, or the sharps or guns or illegal drugs, we can really reduce the risk for suicide in adolescents. Next slide, please. So these are the resources for families, especially during this time, to get immediate help through these. So this is the slides, I think, even though later on we'll share all the information, this is probably the parents wants to take a picture on this slides. So National Suicide Prevention Lifeline, or NYC Well, they provide both the text and talk services to help you to answering how you're going to manage the stress at hand. And then I think disaster distress helpline is also developed, I think, to help the family to manage the stressful situation during this COVID time. If family have any members serve in the military, then you also can please use the Veterans Crisis Line. Next slide, please. Of course, family also can contact your primary care providers, and in the face of emergencies, probably just contact call 911 to help with the with the I think the risky behaviors or anything that's causing danger to the kids or others. So here is the information. I think this is also the slides that you like to take a picture. So on Staten Island, we do have mental health professionals that helping the kids. So one resource is from our hospital. So we do have outpatient services at 450 Seaview Avenue, specifically for adolescents and families. And then currently we provide telemedicine for outpatient services. We provide psychotherapy, psychopharm, available for kids, ages between 6 to 18. Richmond Medical Center is another hospital that not only they provide outpatient services, they also have inpatient services and mobile crisis team, and they provide similar range of services like us. And then Jewish Board and Freedom from Fear, which is very close to our hospital on Seaview Avenue, they provide adolescent counseling as well. Next slide, please. Okay, so again, this is at the end of our presentation. So we want to keep ourselves on the bright side, stay more, like optimistic. So we want to use this crisis also as an opportunity that we spent more time for, to develop skills and mastering coping skills for future challenges. We also use this opportunity for our family to grow closer with each other. And then by working together, we can build a strong community. Thank you for, attending this seminar. And then I really want to, next slide, please. Next one, please. Oh, there, okay. So we also want to thank another two team members, Dr. Hernandez and Ms. Wang, who helped participate in preparing a lot of resources that you will see in the following slides. Right, so these are the slides in the next 6 slides, basically. We'll post it on the internet, showing a lot of resources for parents who have toddlers at home, so that you will observe behavioral changes, and then to learn also the parenting skills to work with your young kids. And then, of course, later on, you will see also a lot of links to resources that will help us to get more skills for self-care and how to work with our teenagers and children at home, and then how to help friends as well, loved ones. So again, I like to to end this. I really appreciate that TYSA and also Staten community wellness partnership that inviting us, having us to share all this information with our families. And then also thank you, I think special thanks to Dr. Lin, who also graduated this year from medical school. And then he contributed, he plays pivotal actually role in preparing for this workshop. Without him, this won't happen. Okay, so next session is for questions and answers.
Yes, so we have a few questions that came in the chat, and if folks want to feel free, we have about 5 minutes left, so we only got 2 questions in the chat. If you have questions now, please feel free to throw them in there, and we will get those to our presenters. But thank you, Dr. Pong and Dr. Lin. This has been phenomenal. This is amazing and exactly what I feel like folks need. And I will be reading those toddler resources after this is over to help manage my own family. So some of the questions that came up were, Adrienne asked a question about her adolescent and her friends staying up late. So she pushes back on standard sleep-wake schedule because of flexibility with their school schedule. If they're getting 10 hours of sleep, does it matter when it is?
I think as long as, I think in general, as we know that biologically, our body do function much better when we follow the, the regular daytime and nighttime, because there are a lot of hormones that's, especially in adolescents, that helping them to develop and grow. So if we have these upside down, routines, that will interfere with their development in many aspects. So that's why we emphasize the routine. Of course, I think the schedule has to be, work out together with kids. And then all these changes of routines will go gradually. So it's very hard to say a kid, for the past few weeks staying up for, up until 4 or 5 a.m. and suddenly you request them to sleep at 10 p.m. It's very hard. So you have to go gradually, an hour at a time to postpone or to change back the right schedule.
Yeah, so on top of that, there's also some studies about shift workers, people who work graveyard shifts who have health effects of working that schedule, and it's overall detrimental to have a that type of sleeping pattern.
Thank you both. We had another question that was asking for specifically suggestions on how we can assist kids. And this was during the mental health disorders, the beginning of your part of the presentation, Dr. Pong, when you were talking about different disorders. So how can we help support some of these kids?
Yeah, so that's quite challenging, especially now they're at home and loss of the structure. So in that case, I think parents needs to really listen to what is really the issue that the kids or their fear or, you know, what causing these changes in emotion and behaviors. And then try to work out with them and avoid, you know, reactive to their emotions or behaviors. And then in the meantime, I think try to connect them with the professionals. So if they do have mental health professional already working with them, and then try to set up more regular schedule for consultation and then to practice skills with them at home. If you don't have, and then this is the time that you probably want to link with them with a mental health professional.
There's another question that says, and this is, Maria, this is from you. So if I'm saying this incorrectly, please let me know. What is the best response when the child is having a disproportionate response? Is that what you're referring to?
Right.
It's like de-escalation parts of that? Yeah.
Right. So it's like, so we say that kids with anxiety, right? So a lot of time they worry about worries. And then they do respond or express their emotions or behaviors out of proportion to the, you know, the task or difficulty that they're facing. So in that sense, I think the first thing to do is helping them to calm down. So we can use distraction techniques that kind of remove them from the situation or remove them from the topic. And then once they calm down, and then that's when we want to talk to them, to listen to them, to see what exactly the issues, and then also provide evidence that's kind of inconsistent or they're descript, you know, different from what they're on their mind. If these are not, you know, working, I think again, resort to professional help. Then the therapist probably can work better with the kids. But I think the first step is to help them to calm down. Distraction techniques, relaxation techniques, these are all the tools that parents can use together with the kids, practicing with them together, as Dr. Lee mentioned.
And we have the links for these coping mechanisms at the end. I think Ms. Rivera, you'll share later on. Okay.
Yes.
Yes.